My name's Dr. Oliver Johnson. I'm director of the King Sierra Leone Partnership, and I'm currently standing on the grounds of Connaught Hospital, the main adult referral hospital in Freetown, the capital city. I first came out here in January 2013 to help set up this partnership between King's Health Partners and key health institutions in the capital city, with a vision of supporting the strengthening of the government health system over the long term, and that's around strengthening the clinical services, the training, the research and the policy. This work was in the context of the impact of the devastating and prolonged civil war that Sierra Leone had seen in the late 1990s, where many of the senior professionals, including the senior clinicians and nurses, senior teachers at the medical school, managers and so on, had either fled the country or had died, leading to significant collapse or weakening of the health system and a lack of senior leading staff. By about March 2014, we'd made some fantastic progress, and we had a small team based here at Connaught building and working on the partnership. It all changed, however, in March 2014 when the first case of Ebola was diagnosed in Guinea. And right from that point, the King's Health Partners team was at the forefront of the national response and preparedness for a possible outbreak. We were involved in advising the Ministry of Health on the outbreak, particularly around clinical management of Ebola cases and how to set up isolation units at government hospitals. We helped set up an isolation unit at Connaught, the main referral hospital, with 16 beds, and ultimately 7 further Ebola holding units that collectively saw more than 1,000 Ebola cases up until December 2014, which accounts for about 40% of all the cases seen in Freetown, which was at the epicentre of the outbreak in West Africa. This also enables us to help keep critical health services open at the hospital. And we had senior physicians like Dr. Terry Gibson, the former consultant rheumatologist at Guy's and St Thomas's Hospital, to be out here on the wards, making sure that patients with malaria, tuberculosis and other diseases could still get care over the last year. And finally, we were able to help set up and guide the development of a Freetown command centre, particularly the case management unit that coordinated over 15 Ebola units across Freetown, but also over 30 ambulances and patients' samples going to 7 labs, so the coordination of the outbreak across the city. This has been a real challenge for what was a small team, but the team has really risen to it. We've increased the number of staff about tenfold over this period of time, with volunteers coming in, volunteer nurses and doctors, and people involved in ambulances and management coming in from around the world, but particularly the UK, to help support. We also had significant support and funding from the British government, and were awarded a grant of over £1 million from the UK Department for International Development. And this team has been working around the clock to help bring this outbreak to a close. So we'll never know what the outbreak would have looked like without King's, but colleagues from the international community and locally say that things could have looked very different if the King's team hadn't been here from the start, helping to isolate patients. The 1,000 Ebola patients that we saw, at the time there were no other beds for them, so if the King's team hadn't been here and opening up other units, they would have been left in their homes, cared for by relatives and potentially spreading the disease exponentially around the city. So the fact that we were here so early on and setting up such a large number of beds not only provided important and great care to those patients, it also helped really reduce the amount of transmission and hopefully protected a lot of our Sierra Leone colleagues, because without this unit those patients could have ended up on the wards or in the general hospital infecting staff. A key aspect of the impact that King's Health Partners was able to have wasn't just the units that we opened and the patients that we were able to see, but the new model we developed of working in partnership with the government to build holding units that was replicated by other NGOs across the country. And we served as a training ground for other organisations, and we demonstrated a new model of care. Similarly with the command centre systems that were established in Freetown could then be replicated at each of the districts in Sierra Leone and help to provide a system in rural areas and around the country, not just for this outbreak but potentially for future outbreaks, showing our role not just as delivery partners but also as academic and thought leaders and as researchers who can help shape the behaviours of others and have a much larger impact on global health generally. The situation is now significantly improved with the number of cases at low numbers, and we're on track to getting to a resilient zero number of cases. But the outbreak will have left real devastation in its wake. We've lost a lot of colleagues, a lot of Sierra Leonean health workers, including 3 senior consultant doctors at Connaught who died of Ebola during the outbreak. And the outbreak also led to a collapse of many of the clinical systems. So we've got a huge challenge ahead of us to try and once again rebuild this health system and build something stronger. But King's Health Partners couldn't be better placed to support that effort. We'll be working over the next few years to really strengthen training, undergraduate training at the College of Medicine and Allied Health Sciences, strengthening training and curricula, teaching facilities, but also getting accreditation for postgraduate training so the country can train its own specialists as surgeons or doctors or nurses who can take up those senior positions that are missing. We're also involved in strengthening clinical services at the hospital. That means lending a hand in departments which are short-staffed, but also helping to develop clinical guidelines and to strengthen referral pathways in clinical systems, be it in emergency medicine or HIV or the ongoing Ebola outbreak. We'll be working on research with renewed vigour. We played an important role in this outbreak. We had a clinical database of Ebola patients that contributed to understanding the disease, and were able to test a novel rapid diagnostic test for Ebola that could have significant impacts for this and future outbreaks. And we want to really build our research work, not only to answer key research questions for the health sector in Sierra Leone, but also to build research capacity. And finally, we'll be working with the government to strengthen health policy. Health policies around specific areas where we're working, be that mental health or dentistry, but also to strengthen a major government initiative to set up an academic health sciences centre here at Connaught, connecting the main referral hospitals in Freetown with the medical school. King's Health Partners is hoping to be at the forefront of guiding that process and helping to establish it as a major academic complex for the future. Now, King's itself has been central to all the efforts we've been doing. King's Health Partners staff have been coming out to provide senior technical advice on short trips, but also they've been able to provide advice from the UK by email over Skype to guide all the work that we've been doing. Many of our volunteers have also been from the King's community, with lots of alumni from King's College London applying, or staff from across King's Health Partners coming out to join the in-country team. And finally, the response we've had from the King's Health Partners is fundraising has been extraordinary. We've raised over £500,000 from King's College London alumni and from the King's community that have been central to our being able to scale up this work. So it's going to be a challenging few years ahead, but also a really exciting opportunity for us to really build a strong and resilient health system in Sierra Leone, but an opportunity that's going to need all of King's Health Partners to come together to contribute, be it the university or the 3 hospital partners, right across from senior managers or clinicians or academics to junior staff and to support teams, who we hope will all come together and to play a key role in achieving these aims, supporting Sierra Leone partners, but also in recognising King's Health Partners' role as a major global institution and a key partner for global health.